So lean diabetes is a specific kind of diabetes that occurs in very thin people with BMI less than 18.5. So this is particularly common in the Asian regions, China, India, and other Asian regions, and some African regions. We don't know why this comes, for some people, but there is a thought process around protein energy malnutrition.
I see.
So the thinking is that because of this malnutrition, the development of the pancreas and the beta cell is less, and there's less insulin secretion, leading to diabetes. So this is what we call lean diabetes. Yeah, so insulin is an anabolic hormone, which means insulin is a necessary hormone for life. It's necessary for growth and activity. So deficiency of insulin leads to a state of extreme weight loss, what we call catabolism. So that will happen if there's insulin deficiency. So for these individuals who are insulin deficient, they naturally tend to be very lean. It doesn't work that way.
Okay.
So they're not opposites in them. They have different pathophysiological mechanisms.
Okay.
So if you look at body fat, okay, for someone who's obese, you could have body fat deposition in the subcutaneous space. So that's the arms, the legs, the hips. So this is visible for us. But you can also have body fat deposition inside of your tummy. So on your liver, on your kidneys, on your pancreas, and all of this body fat is actually more dangerous than the subcutaneous body fat. So in someone with lean diabetes, they may not have subcutaneous, but they do have intra-abdominal or visceral fat. That's a very good question. And the answer to that is yes. Those with lean diabetes tend to have higher glucose values than someone with obese, because of the insulin deficiency. So they tend to have higher glucose levels. They also progress more rapidly into retinopathy, eye disease, kidney disease, nephropathy, and neuropathy. So these are what we call microvascular complications. So they progress very quickly into microvascular. We have data to show that the progression is quite fast, much more than the obese type 2 diabetic. So that's a really fabulous question, something that we get asked a lot. So as a physician, people come and say, Doctor, I'm lean. Should I be doing more exercise? What can I do? So nutrition is not just about weight loss. It is about the balance that is required for your body. So if you have a lean phenotype, then you have to have a diet that regulates your protein intake. So increasing your protein intake does two things for you. It'll prevent weight loss because you build muscle and, you kind of, it's not fat. Muscle is heavier than fat. So it promotes you, it helps you to gain weight. That's one. The second thing is the more protein you eat, the less your sugars will spike. So carbohydrate is the one that spikes the glucose levels all the time, whereas protein, on the other hand, doesn't spike it. So for someone who has a lean phenotype, we would suggest that they increase the protein intake in their diet, increase the fiber intake in the diet, do the recommended level of physical activity. So about 150 to 300 minutes of moderate to vigorous physical activity, and see that they have balanced nutrition so that everything is in order in terms of, so for example, we talk about a rainbow color in diet. So if you have all the colors, you have yellow and red and purple and green on your plate, then you know that you're getting all the micronutrients and vitamins and minerals that your body needs. So it doesn't mean that you lose weight. It means you can regulate it quite beautifully. Supplements are an option for those who say, I'm not a big fan of supplements, but it does have its uses. So if you can get a healthy diet in natural form, that is the best thing for the body. So we believe that, nature is the best. But if you have a digestion issue, or you can't, you're vegetarian and you can't get enough protein, then of course supplements do have a very valuable place in that kind of nutritional regime. So as you rightly say, the treatment for lean diabetes is different from the treatment for obese diabetes. Here, the primary problem is insulin deficiency.
Okay.
So naturally, you would think that insulin is the first and best gold standard treatment
Yes.
for those with type 2 diabetes.
Yes.
So in the management, you start with lifestyle, your diet and exercise. Metformin always has a place because it's first line in most drug therapy. But in these individuals, particularly because they progress fast and the glucose levels are quite high, insulin may be coming pretty soon in the management of the lean diabetes, so gold standard. Now, particularly with our GLP-1s that we're talking about, now these are new kids on the block and they have a whole list of cardiovascular benefit, renal benefit, so many things that, we can actually see. But in this case, in the lean diet, it is an option to consider, but one must take into consideration the considerable weight loss that they bring. So maybe not first line, but, so first line, maybe we start with diet and exercise. We can always, you start insulin, metformin, and we don't have enough data to support. While we know that it does help cardiovascular and renal outcomes in type 2 diabetes, we don't have lean specific data on GLP-1 right now, but maybe it's something that will come in the future.